campus safety, mental health has been something on our radar for years. So we've been continuing to request support for that, and I know we're doing our own individual things to enhance those services on our campus. So with that, I'm going to introduce Alexander Jordan, the Deputy Director. And he is going to be the facilitator for the panel. So with that, Alex, it's all yours.
All right, thank you. Good morning, Council. As President LaBossa mentioned, there has been a lot of things going on over the last couple of weeks as it relates to campus safety and security and the tragedy that happened down in Parkland. And we're gathered here today to try to identify some best practices and strategies and collaborate with some of our community-based organizations that will help us move forward and move the needle towards what we need to do to improve and work forward on some of the campus safety and security measures. And this morning I have a couple of panelists that I would like to take a minute to allow them to introduce themselves. We can start here with Brandon.
Yes, good morning. Brendan Cotter. I'm the Chief Revenue Officer of a company called Social Sentinel. And the body of our work is really understanding early indicators and warning signs of trouble that could be towards, trouble, early warning signs or indicators, whether it's mental health issues, self-harm, or harm to others within public social media. So thank you all for having me today.
Hello, my name is Lara Zwilling. I'm lucky enough to be the coordinator at the Counseling Center at Santa Fe College. Santa Fe College is one of the few colleges that provide mental health services on campus for our students. I'm also the chair of our trauma response team, and I'm the co-chair of our behavioral intervention team on campus.
Good morning, my name is Prevatt. I'm the manager of public safety for the College of Central Florida. I've had the pleasure of serving in this position for a couple of years now, and I'm really excited to be here today and have this discussion with you all on this very important topic.
Good morning, everyone, and I'll remind Doug that he's also the chair of the Campus Safety Commission, a huge thing for the association. My name is Marjorie McGee, and I also have the honor of being the Director of Student Life at the College of Central Florida, and I am currently your President-elect for the association and also a certified ALICE trainer.
Good morning, Mike Watkins. I'm the CEO of Big Bend Community-Based Care. I'm also the President of the Florida Association of Managing Entities. So we provide all the community mental health, public funding across the state. So we incorporate all 67 counties, and I look forward to the discussion.
Thank you very much, panelists. The process that we'll have a few selected questions. Questions that would be specifically for the panelists, or it would be in general for the overall panelists to respond on. With that, we would then follow up with questions and answers as it relates to some of the questions or some things that were presented by the panelists. And what we'll do is we'll go ahead and get started with one of the first questions. And this question will be for all five of you panelists to respond to. What are some of the identifiers that for serious problems that as it relates to mental health concerns within our students within some of our colleges?
So in 2016, the Healthy Minds Network did a study and found that community college students nationwide, of the community college students nationwide, about 50% reported that they had either a current or recent mental health condition. That's 50% of community college students nationwide. That's really significant. And so, you know, it comes back to thinking about what resources do we provide our community college students. But back to the question, of those 50%, let's look at the ones that really concern us. And those are the students that may have said something that they're thinking about harming themselves. They may be presenting with self-injurious behavior. They may have friends coming to us saying, we're really concerned this person hasn't left their room for a week. Something's going on. And so I think we really need to pay attention to these, and that's where the behavioral intervention teams on college campuses are just really vital. Because I don't think it's a one-person decision to make regarding a student's a future, what's going on with them. If all this information is presented to a behavioral intervention team, we can gather more information and therefore make an appropriate decision and help that student. Because oftentimes we find it's just a student has an unmet need, and if we're able to meet that need, be it medication, be it resources, it doesn't turn to violence. It doesn't turn to self-harm or That's what I'm seeing in there.
Real quick, Mike Watkins, could you elaborate and help us to understand a little more how the need, as Lara just mentioned, on the needs for resources within our communities, with your organization and others around the state? Could you kind of give the little more details on that, how we can better? And what we're doing is we're taking notes on some of the feedback and the recommendations that we have, so that we can come back and look at this at a later meeting and identify how we can continue to move forward. Mike?
Yes, thank you, Alex. There's a couple areas that we've been intensively working on for the last 3 weeks, and I will tell you that we're trying to separate kind of into two categories. One is the ongoing mental health needs and wellness for not only students and public schools, but state colleges, universities, and other places. And then also really the catastrophic events. So as I've met with the both Senate and House leadership, we're talking about really making a strong distinction between sociopathy and general mental illness or mental health and well-being. So I would encourage you, as you talk with the assets that you have inside your universities and as a group, as a collaborative, to really talk about strategies that are focused on one or the other. And I think that's been part of the problem that we've had in the public debate in this session around the Parkland shooting, is trying to separate those two things. When it comes to mental health generically, in this state we have 2 publicly funded mental health resources. One of the state hospitals, so a lot of you are familiar with the state hospitals. That is a very small resource in terms of population. I can give you an example at Chattahoochee. A lot of people call it Chattahoochee Florida State Hospital. In its heyday, we had more than 30,000 residents at Chattahoochee. Today, we stand right at about 3,000 residents at Chattahoochee. And the reason for that is we went to a deinstitutionalization model. And most persons are kept in the community, and of course, we want to do that in a safe way. So that is a separate entity, the institutions, and there's 3 of them across the state. And then the second part of that is community mental health. So the intention was always to work hand in glove, that you have institutions for those that are required to be inpatient and those that are being served in the community. So the Florida Association of Managing Entities, and there's 7 of them. I have the map here for you by county so that you can get your local contacts. And I think an important strategy, Alex, is for you guys to know who your managing entities are. We are managing $700 million in community mental health and substance abuse. The only eligibility requirement is that the person doesn't have insurance. So if they have their insurance, they need to pursue that as a resource. If they exhaust that, and that often happens, even with Medicaid, you can exhaust a number of behavioral health visits, then this is a resource for you and your community.
Thank you, Mike, very much. This question.
Alex,
go ahead.
I think one of the most important things to remember is that we cannot predict violence, but we can identify those risk factors that do exist and notice and respond to the behaviors that we do know about, some of those things that Lara mentioned. And when it comes to our students and our campuses and our staff, also anything that maybe interferes with normal function of the college, those disruptive behaviors that can lead to some of those other more aggressive behaviors, anything that habitually interferes, inappropriate demands that our students make sometimes can be some of those indicators. And obviously, the obvious thing is threats, when they make those threats to us, around us, against us. Those are really things we need to key on and identify and respond to them in some way, shape, or form. Thank you.
All right, thank you. And, Marjorie, that was great to segue right into that, because that, from a counselor standpoint, I wanted you to follow up on that. But you mentioned about threats and some of the concerns that some of our law enforcement and our campus safety security directors have. Doug, could you give us a little idea on how your college handles and addressing some of those concerns that Marjorie just mentioned as it relates to threats?
Absolutely, we do. We have a form called a silent witness form on our campus. So our students, staff, and faculty can fill out that form in 2 ways. They can go online and fill out that form, or they can come to the public safety department and fill out that form as well. What that does is allow them to anonymously report any concerning behaviors that they may feel that we need to address without fear of reprisal or their name getting out, so to speak. That's helped us in that's been a very effective tool for us. We do, again, when we find out those things, we address it right then. We have to have a lot of flexibility when doing this. Sometimes we use the Dean of Students. Sometimes I'll go myself. Sometimes Marjorie will meet with students. We're all one team. You know, we try to work together, and so far it's helped. You know, I won't say it's a perfect model, but it is a model that we use, and it has been beneficial.
Thank you. Anyone else on the panel like to elaborate on that?
Just a small thing, and it might not seem significant, but we have walkie-talkies on our campus that we have in key offices on campus. I work with students all day, every day, and my office is also shared with the Veterans Center, so we have a very sometimes volatile population when it comes to our student veterans that are just coming back from combat. But I have walkie-talkies in my office, and if I need Doug in an instant, I can turn to my campus safety station and call Doug, you know, hey, we have an issue over here, can you guys come? Obviously, he's in my phone as well, and I can call him on a campus phone, but our walkie-talkies also can connect us to our campus safety, as well as our maintenance staff and other key players on our campus. Again, it's a small detail, but it can connect me to Doug and his team immediately.
Well, you had a question, I think you were going to follow in?
Oh, no.
Okay. Yeah, okay.
Wait for the second question.
Sounds good. Go ahead.
That's on
What we found in doing 4 years worth of work within public social media is that there's a tremendous amount of indicators that exist. We currently work with over 200 colleges, universities, and K-12 settings, and we have had some profound impact by a lot of these early warning signs and indicators that a young person is looking to do self-harm. And by getting this information into the right training programs in a timely manner, it has had a very positive impact on that community and that culture.
Thank you very much. Mike, could you share some communication tools that is best noted for working with the colleges and other universities that you're currently doing right now? How the resources are allocated and how we can communicate that out?
There's been a real focus on K through 12, so just to have a honest discussion with you, that's where we spent most of our time coordinating. Since the Parkland shooting, I've got from Madison Taylor to Escambia, so I have 18 counties in the state. In those 18 counties, we've had 24 juvenile arrests and 1 adult arrest who was an 18-year-old in Waukalla County that was a senior in high school. So for those 25 young persons, we're arresting, law enforcement's arresting them for threats, and then what's happening is we, under the current legal structure of the criminal code, there's nothing much to hold them on. It's pretty sparse in terms of being directly pointed at this issue. So we're struggling with that. I think legislature's taking some of that up. And then the schools are expelling all these kids, and I think about you guys as a very important other group, because you have a lot of these kids, you know, that are 1 year older or maybe 2 years older. They're expelling the kids, but that's not really addressing the problem. And that's what we're trying to get at. What we're talking with those stakeholder groups about right now is a community threat assessment. I'm aware of 2 tools that have been promulgated for community threat assessment. One was done by Dr. Tony Belize and is in use in Los Angeles County. So I have that resource if you're interested in that. We actually have the tool. It's an evidence-based tool. There's also a tool in Houston that's being employed that was developed by the Secret Service and the Department of Justice for targeted school violence threat assessment. What we're doing here in Florida is we're working with University of South Florida, which has already had some efforts underway to try to evaluate tools around the country and to try to employ a protocol. And Alex, I'm not sure if I answered your question, but just to tell you that that's the strategies that we're employing right now, is to try to really discern between those kids, those young persons that are making threats that are not going to be carried out versus the ones that we think could carry that out.
Mike, you did answer my question, and that's where I was going next, is the threat assessment. Doug and Brandon, could you share with us some social media outlets that would help us to be able to understand what may be going on within that community, as Mike mentioned about threat assessment? Doug?
Absolutely. I know of several colleges in our system that are using products such as these to great success. Unfortunately, our college isn't one of those. We're monitoring some stuff on social media. Some stuff is slipping through. I think that comes back to a function of our budget, comes back to our funding, things like that. It's very important to support these type of things. You know, when I went from a municipality back to working in a Florida college system, I wanted to come back to the Florida college system because I felt it was home. Everybody else that I knew, my family, my friends, they thought I was coming back for that state job. Because how do we feel about those state jobs, right? We're traveling down the road at 60 miles an hour. We're seeing those 4 guys with that one shovel on the side of the road digging one hole. We drive by them at 60 miles an hour, right? We're thinking, why are those other 3 guys not working? Well, do we ever slow down and talk to those guys and maybe they only have 1 shovel? You know, maybe those other 3 guys are electricians and they're waiting on the 1 guy to dig the hole for the conduit. You know, so I would encourage you to slow down, take a look, and really talk to your public safety, your campus safety, your law enforcement around campus, and find out what they need, address those needs, and really support them in their roles. You know, I feel that's really important. You can have the best intentions in the world, but if they're not properly trained or properly equipped with some of the tools that are out there, you know, it's not going to do, you're not going to be as effective as you could be.
Sure.
Thank you. So I feel that your project is incredibly important, and gathering information is the way we make decisions. But I think that we have to have people tell us what's going on. You know, I mean, we have to have people out there that are trained and able to respond and recognize and refer and see something on social media or notice that their classmates acting strange or their behaviors change. You know, we can't really rely on students to come into the counseling center or to come to public safety and say, I'm not feeling well. I think I need to, you know, be vaporized. That's just not going to happen, you know, and so we do that through training and education. And, you know, I work very closely with our law enforcement officers on campus, and we provide frontline safety training. And that has a component of prevention, which I talk about de-escalation, I talk about reporting and what reporting looks like, and how reporting is a scary word to some people. If you're going to report someone, that doesn't sound great. But then how it can really help. It's a care process that we can help that student before they do turn to self-harm or harm to others. And then the second part of frontline safety is response. And so our law enforcement officers go into the offices, really, of everybody that works there and talk to them about their workplace and the safety and what to do if something horrible were to happen. So I guess my point is absolutely we need to be able to recognize these things, but we need to we need to create a campus of culture and community and just all be together and realize that it's just not the police department's job, it's just not the counseling center's job. All faculty, staff, everybody needs to really be on board and report, even though that's a scary word, but report.
If I could, Alex, and kind of going towards talking about threat assessment, behavioral intervention, Michael, if I could refer back to last year, we did a campus safety survey that we sent out after a team of us went out to Oregon to Umpqua Community College and met with their team. Of our 28 colleges, only 17 responded to that survey. And of the 17 that responded specifically to the question about do you have a threat assessment team on campus or a behavioral intervention team on campus, only 13 of those 17 said that they did. That's half of our colleges. Granted, not everybody answered or did the survey, but still that number is a little scary that only half of us have teams like that in place. The question kind of went on to say, how do you use your threat assessment team? How do you use behavioral intervention? Most of them kind of use them together as one, but at least they are doing something. And that it is a key component to our mental health and keeping an eye on our students is having that team in place on campus that includes everybody. We have to connect every dot on our campus, from administration down to the students, down to the plan operations staff, to campus operations. Everybody plays a role in the mental health of our students and the safety of our campus.
And having that team well trained through the Association of Threat Assessment Professionals out in LA. I think they and then the National Behavioral Intervention Association, really important.
Thanks for the help, Marjorie. One of the things that this is about, for me, is about relationships. So at the end of the day, it's my 27th year working in child welfare and behavioral health. And it ultimately comes down to who do you know to call. And Madeline asked me to come today, and I appreciate that opportunity to try to bridge these two worlds that we work in, because we're all going to go back to our familiar desk and our familiar office, and we're going to interact with the same circle of people that we interact with every day. And I'm here to tell you that there's a big wide community out there in behavioral health and public community health that you can tap into, and you have a perfect nexus to this community, and I'm going to give you the secret for free. The perfect nexus is we need workforce. We need licensed mental health counselors, we need social workers, we need clinicians. We have a real shortage of people that are taking on this work and doing this work. So I know you guys need our help and our resources. I'm telling you, that bridge is paved with. What can you do back for me and get my attention is, how do we connect your workforce and your students to the industry that you need resources back from?
I'd also like to add, we need those folks on our campuses as well.
To echo what most of the panelists have said is that we have seen from a data standpoint, social media really grow in the last 5 years at such a pervasive level. And when you think about the mobile devices in everyone's hand, and you think about the access to an immediate pulpit to thousands, if not tens of thousands, that everyone has through social media, it's changed the dynamic. It's changed the dynamic in terms of self-worth, bullying, cyberbullying, and sort of instant perspective and attacks. It changes the mind in a young person, and that many of the studies have shown, for example, like Pew Research, that an average 13 to 20-year-old may be interacting with social media in excess of 100 times a day. So the volume that we see is about 1.5 billion public social media posts per day. So when you think of all the mental health and public safety professionals that are on this panel today, this number is overwhelming and it's inundated. But inside of that are so many clues to what's going on in someone's mind. And there is a critical need to enhance the education and awareness of not only mental health professionals, but the entire institution. Because with this rise in almost epidemic levels of self-harm becomes also the very fragile tragedies that have happened in Parkland. And having the ability to see a process to interpret and understand and assess these threats is becoming a critical factor in not only just education, but our society as a whole. Because as many tragedies as we've seen in education, we've also seen those tragedies in the places we like to go, whether it's clubs or sports or hotels or venues. So to really have a proactive way in which to understand how some minds may be thinking and have a chance to assess that proactively is becoming a critical part of our lives.
Next question is for Lara and for Marjorie. Can you share with us some good working module that demonstrates good relationships with the colleges to work with their student body as they may need services or issue that may come across them? Can you give me the panel and elaborate on that as well?
So if I understand your question,
good business models that Santa Fe and College of Central Florida have in place as it relates to working with the students.
to serve students
Yes.
in health needs?
Yes.
Okay. So as I said initially, we have a counseling center with four full-time licensed therapists. We're blessed to be in just like you are here in a college town, so we get graduate interns. And so with four full-time, 1 part-time, and 2 graduate interns, we saw 2,200 students last year that needed mental health care. We also provide suicide prevention training across campus, and why that's important is people are interested in that, and people want to hear more about that. And when you're completed with the suicide prevention training, you're called a gatekeeper. It is a sense of responsibility that one has. And we really have seen much higher reporting. I'm worried about my friend. They posted this on Facebook last night. Can't get a hold of them, that sort of thing. So that's been really great. We also, I mean, we're talking about community a lot. We contract with we don't contract actually. This is a free service in Alachua County. It's called the Alachua County Crisis Center. And after hours, they respond to our students and they perform wellness checks for our students. And that's usually in the hands of law enforcement to make sure that someone's okay and go perform a wellness check. But these are counselors that go out to these people's homes. And then we have a direct relationship with them, so they'll let us know. I would say the last, when you think about community, all our receiving facilities, all our hospitals for behavioral health in the Alachua County area they ask the student upon discharge, are you a UF, are you a Santa Fe student? And if they are, they receive our information about the counseling center and mental health services that we can provide and what we can do to assist in their recovery. But it's good that we know that. We need to know that one of our students was hospitalized. I mean, we need to know what's going on, and we need to have that pulse of the student. So that's essentially, some of the things that we do. We partner with our student life because that's how we figure out the pulse of the students. Marjorie.
Thank you.
A couple of things that we do, and we're a little bit different from Santa Fe in that they have a counseling center on campus, which is the most amazing thing. I think everybody would hope and pray that we go in that direction for all of our colleges. We contract with daycare. Many of you are familiar with daycare services. It's a 24/7 hotline that our students can call, and then they can get referred out to receive some help. They get up to 3 visits with somebody. The interesting thing about daycare on our campus is it was started by our students. Our Student Activities Board on our campus, which serves as our student government, decided that it was important to have that resource for students 10 years ago. I believe it was in 2008 when we started, following Pasco Hernando, who had started it, and they voted and put it in their budget each year to provide that service free for our students on our campus. Like Santa Fe, we also have suicide prevention. We have a suicide prevention grant that is very active, and we do a QPR training, another acronym for everybody to remember. We have so many of them in the college system, but that does stand for question, persuade, and refer, and it's an hour-and-a-half long training that anyone on our campus can go through, students, staff, faculty, and at this time we've had over 700 people go through the training. A couple of weeks ago we recognized Suicide Prevention Day and invited everyone. You get a t-shirt when you're done with the training, and the t-shirt says, "Are you okay?" And that is kind of our gatekeeper, if you will. That way you know this person's been trained, and we kind of know what questions to ask, and we recognize the people that have been trained, just to bring more awareness to that self-harm and suicide. Obviously, working in student life, too, we have lots of outlets for our students, stress buster events and yoga clubs and things like that. We have an early alert system on our campus that, again, staff and faculty can participate in. If students are not coming to class or grades are starting to decline, things like that, they can refer immediately to our Dean of Student Services, where we do have some counselors on staff, just not a full-blown counseling center, but we do have a licensed counselor on staff that helps with that. Doug, did I miss anything for our campus?
No, I think that's it. It's just really important to know that daycare is a great product. However, it doesn't serve the needs of every single student. I would highly recommend, if you don't have a counseling center on campus, start looking at adding one to your campuses. The benefits of having one there far outweigh the cost. Thank you.
It's kind of that, hear something, say something. That's one of the biggest things, from a law enforcement background that I have, is that you see something, you react. But when you hear something, you need to react as well, because we just never know when the situation may escalate to something that I would have said, oh, I heard it, saw it on social media, but I did not respond to it. In this day and time, it's so important that we at least put something forward, put an effort for it, that, hey, I heard about this, I saw this on social media, and this is what we need to do, how to address it through the appropriate folks at our colleges and institutions. Go ahead, Laura.
I'm so glad that you said that, because I think part of the training is to teach people that it's okay to engage with someone in crisis. It's okay to report if you see something. People have this mentality of, it's not my business. I don't want to report. It's not my business. And so we really need to train people. Look what's going on. And so I think it's just really important. People aren't, I think we assume that people are comfortable engaging and talking to someone in crisis or that seems distressed or disturbed. People aren't. And so it's really important that we, and that's a simple training, that's a QPR. That's something where you can just say, this is just what not to say. But as long as you're able to do X, Y, and Z, you're going to be fine and engage, and it's going to be a good outcome.
Jumping back in here, segueing into crisis intervention training, that's something that a few colleges do, and some that a few colleges don't. What crisis intervention training is a 40-hour block of training that puts a person on the front line, actually trains them how to walk them through the process of speaking with a person, how to deal with those responses, and feel like they get a good experience, overall experience with it. I know Santa Fe, every single one of their police officers goes through crisis intervention training. You do not have to be a law enforcement officer to take the training, but it does help with those interactions. I've had non-sworn personnel go through it. Highly recommend the course.
We'll wrap up with thank you guys for being part of the panel this morning with us. But what we're going to do is open up the floor for questions for the presidents and anyone else who would like to. Chancellor, I see you have your hand up there.
Yeah, I have a question. Thank you so much for being here. It's to Mike. So there's two camps, right? The colleges long time ago had counselors, and the decision was we shifted from that for lots of reasons. One, managing risk, since we would not have counselors 24/7. We would never have. We have a 1 to 1,000 advisor ratio. So, you know, in a time where there's budget constraints, what are the pros and cons of saying, okay, if we put counseling centers at every college, then what's that ratio look like? And sure, that looks probably, you know, to the tune of about $500 million probably if we were going to do that with limited hours in service. Versus if there's organizations within your network, what are the possibilities of those organizations having offices on campus maybe during daytime hours and then being available during evening hours? 65% of our student population is enrolled part-time, and the average age is 26. So the reality is they're probably not going to be on campus to come to counseling or have a crisis, that we probably need to connect them closer to home or closer to work for those services. So just your insights, because that's a real philosophical, fundamental discussion that the presidents will have later in the summer about how we put together legislative budget requests going into next year. So I'd like your insights.
Yeah, thank you, Chancellor. I met with Senator Bill Mumford, and he's been a champion for education for a long time. He's our local senator. Some of you, I'm sure, have heard his name. And he sat down and he said, Mike, do we need to do this? Do we need to do that? And the answer was yes. We need to do probably all of that. Prevention, CIT. We haven't talked about mental health, first aid. There's all kinds of things that I think we need to be doing. So to the degree, my answer is simply is to the degree in which you can bring those resources to bear in your own community that are organic and localized, I think that's a real plus. I do, however, think that there's probably a lack of resources for all of us. We're trying to meet budget constraints. And I fear that we're creating shadow systems. And I've been very direct about that with the legislature and with this governor. And I think that we should have centers of excellence around mental health, just like we have for any other medical profession. If we had a cancer outbreak in the school system, I don't think that you would go set up cancer centers in your state colleges. I don't believe that you would. So I think there's a decision point for you all as leaders to try to weigh out how much do we build in house versus how much do we leverage and buy in the community. And I'm not here to suggest that you spend money with us. We are a paid volunteer service. $700 million that this legislature has invested in behavioral health. That's both substance abuse and mental health for the community. I think you should be leveraging that. Every single Baker Act that you've ever had in the history of the person sitting in this room has went through a community mental health center that's funded through the managing entities in the state legislature. So we already have the complete inventory of persons being Baker active. That's one portion of the system, granted. That needs to be able to interact with your folks, I think, optimally in a seamless way. So if you don't have a relationship with your community mental health centers, the Bay Cares, the PARs, the Lakeview centers, the life management centers, and thank you for the year at Gulf Coast that helped me become the person I am today. Great experience there. I'll just tell you that don't go out and create something that is already in your community. Try to leverage that, at least have the dialogue to figure out where the bridge starts and stops so that you can take advantage of that.
And I have one question for Santa Fe, which is when we talk about centers of excellence, I understand, and maybe you can share with the group, that you have one of the things that emerged right after the Parkland from our Council of Student Affairs and Instructional Affairs, who quickly got together and gave the presidents 4 strategies that we could consider. On the top was data sharing. The disconnect between K-12 and colleges. So if you have a student having these issues in the K-12 environment, when they come to the colleges, we don't necessarily gather that information. I think Mike just alluded to it as well, the disconnect between mental health agencies within our communities not telling us they're seeing one of our students who could be a potential threat, right? You have something called BRIT, my understanding, where you do meet with community. You have K-12 at the table, you have public safety, and you have the college at the table as community partners. Do you know about that?
What was the acronym again?
Maybe BRIT?
BIT?
Maybe.
Okay.
Maybe, yeah.
Well,
That brings outside people, because that's what I want. You know, today was about kind of opening up our minds to all the things that we can be leveraging, and then creating those best practices that inform the strategy going forward. And I heard about the program, and I've heard good things about it.
Yeah, so I'll quickly talk about 2 things. First, when we have our BIT team, it is only college officials.
Okay.
And that's actually, it's a good thing that the counseling center is represented on the BIT, because my concern about confidentiality when seeing a student kind of goes out the window if they're a harm to themselves or others. So I'm able to kind of talk a little bit more about the student, because we hear at that point about their life. We also do have it's called the Trauma Response Team, and, Crisis Response Team. And this is a group of, they meet at the University of Florida, but it is K-12. So it's all Alachua County, public schools, Santa Fe College, community mental health, and the university. And so at that point, we're sharing things, usually not student names, but it's very nice to be able to be in an environment where everybody has the same mindset of, we're here to help the student. You know, again, confidentiality we're not concerned about if we think they're going to harm themselves or someone else.
Great, thank you.
Mike?
Yeah, thank you, Alex. I appreciate the time. First, I want to thank all the panelists, and on such short notice, barely a week, to organize themselves and agree to be here today. And thank you, Alex and Chancellor, for fleshing it out with Mike. And again, thank you, Brendan, for your support. A couple things I want to just tag on. Marjorie kind of addressed them a little bit earlier. Number one, there's a distinct difference functionally between a behavioral intervention team and a threat assessment team. And that's a distinction that we never want to lose sight of. And we don't want to be lazy and think that one can serve both purposes. When Marjorie and I went with a team of other AFC people a year and a half ago to Umpqua Community College for the threat assessment training, that was one issue that they made abundantly clear to us over and over in that 2-day workshop and training, was that they have distinctly different functions. They may have some overlap in the people who are involved in both, but they have distinctly different functions and serve distinctly different purposes. So we can never lose sight of that, and I think that's why it was important to pull together a panel that included a public safety person as well as 2 people from student life, and particularly one who was involved specifically in student mental health counseling. And so that's something we never want to lose sight of. I also want to refer back to the survey that the AFC did
not too long ago, about a year ago, and it yielded some very interesting information, as cursory as a survey it was, and as Marjorie alluded, only 17 colleges did respond. But we did see in that, what I was just saying, that there is some confusion about bit versus tat, and are they different? Do you have both? Do you have one, or do you have the other? Prior, in the last 2 years of the association, through our Campus Safety Symposium, now this year we'll be offering our third Campus Safety Symposium in July 12th and 13th at Daytona State College. In the previous two, we have focused very heavily on threat assessment because we were facing those issues, particularly with the potentiality of guns being allowed to come on our campuses and things like that. This year, we're going to kind of find a happy middle ground between both and focus a little more on mental health and behavioral intervention strategies and kind of pick up on some of the topics that you all have mentioned here. One of the things we're looking at, Presidents, is a partnership with a group. I don't know what the acronym stands for, and I can't find it anywhere on their website, but it's NCHERM Group. They offer a behavioral intervention team foundation training program, and we're looking at partnering with them and offering that as part of our Campus Safety Symposium. It's a 2-day workshop that they offer, or as a kind of pre-conference to our Campus Safety Symposium. I've got the cost whittled down from their initial $1,600 a head to about $650 a head, and if I can finalize that arrangement with them, what I'll be doing is coming to you before I make an agreement with them. I will be coming to all of you Presidents and seeing, A, if you're interested, and B, how many people you would be willing to afford to send to participate in that. And once I have that and a hard number and commitment from you all, then I'll feel comfortable about going ahead and making an agreement with that group. They need a $35,000 minimum. At $650 a head, we don't need to pull together, but 40 or 50 people to make that happen. So we are very focused, though, on the separation of the behavioral intervention from the set assessment, and I'm very, very impressed that you all were able to make that distinction. It's an important message to carry back to your colleagues in that regard.
All right. Well, I'm gonna close out with my question, and this is going to be for Brandon. Is your system, your program, throughout the state of Florida in higher ed? And if you can you elaborate on the social media as one of the spoken language on social media?
Sure. We're in about 9 colleges and universities and 1 K-12 district currently in the state of Florida as part of the 200 that we have nationwide. We currently cover 13 different social media companies, all under public data only. So as a few of the panelists talked about a trip to Linkwood Community College in Oregon, what was discovered there is that perpetrator was putting out signals and indicators on a social media called 4chan, which is one of the 13 sources we have. And the reason we added that because of that particular event. Social media is a constantly evolving process, but in our premise, we wanted to only look at public data only. We did not want to touch private data only. We did not want to compromise an individual's First and Fourth Amendment rights. Part of what social media is that point of expression. I mean, you're making a conscious choice to say, I'm in trouble, or I'm dominant, or I am going to hurt you. And how persons express themselves are not just single words. It's not just shoot, bomb, gun. It's a very complex narrative that could be keywords, phrases, slangs, hashtags, acronyms, and it's all in this mix. And we have spent 4 years with many mental health professionals and counselors and public safety and law enforcement evolving what does this language look like and how is it utilized. So you're taking a lot of substantial data. You're not looking at individuals or groups, but you're understanding content of expression. And then when you associate that to where that belongs, at what college, what university, what K-12, then it's disclosed as an alert. What is that content? Who is that individual? And allows you to assess that risk. And we do get involved in standards and best practices and training, and how do you take this information and assess it properly in that mix. It's really an inverted triangle of $1 billion to $1.5 billion posts per day that are hitting these public social medias that we cover in the 13, all the way down to what really is a half a dozen or less per day on average, depending upon what your college or university is, demographically, geographically, what other events are happening in the day at that time. Try to get something that's manageable so that you can be ahead of it. Because when you think about see something, say something, it's a great culture, but it's going to catch just the little pieces. And we're also asking young minds to assess information that they see from their peers. They're not always trained to do so. So we're advocating a process that can eliminate some of this. And it's reasonable in nature, and it's a process that has shown clear efficacy in the last 3 years, at least, that I've been doing this type of work.
Mike, you had one more?
Just quickly, we spent a lot of time talking about violence. The legislature just passed a $54 million budget for opioid response. We have 15 Floridians that die every day on opioid overdose. So I know that you guys have a busy agenda this morning. I just want you to know that all of those dollars are coming through the community substance abuse centers, through the managing entities. So I think that's an incredible resource that you should be accessing to try to thwart some of our opioid addiction.
Alex, thank you.
Thank you. I will go ahead and close with the challenge.